Welcome to the IRIDEX Cyclo G6 Laser System Surgical Training Didactic. The IRIDEX Surgeon Certification process is as follows. Step 1, complete the online didactic module and following quiz. Step 2, schedule the surgeon dry lab training and OR staff in service. Step 3, perform 3 proctored transscleral cyclophotocoagulation procedures. Ideally, this should occur the day after the surgeon dry lab. Once this is completed, you will receive your proctored certificate, and you will be able to reorder and perform transscleral cyclophotocoagulation within your system. The second phase to the surgeon certification process is after you complete 30 transscleral cyclophotocoagulation procedures, you will be able to choose from a number of practice development programs in which you would like to participate. Please contact your area sales manager to hear more about these options. The IRIDEX Cyclo G6 is a continuous wave 810 nanometer diode laser. It is a thermal laser with coagulation effects that equal tissue necrosis. But by using low to medium power and durations, we produce local heating and denaturing of proteins, but not acoustic effects or lysis of chemical bonds. The target tissue or chromoform for this wavelength is melanin. Melanin is present in the iris, trabecular meshwork, retinal pigment epithelium, ciliary body, and the choroid within the eye. It is very important to remember that other chromoforms like hemoglobin and marking pen spots will also absorb laser energy and can diminish the desired efficacy if present on the field and potentially create new complications. There are 2 treatments available on the Cyclo G6 glaucoma laser system: continuous wave mode and micropulse mode. Transscleral cyclophotocoagulation can be delivered in 3 different ways: utilizing the delivery devices G-probe and G-probe illuminate for the continuous wave mode, the MP3 or micropulse probe for the micropulse mode, and it can also be delivered endoscopically to all treat the ciliary body. Continuous wave diode laser treatment for end-stage glaucoma has been around for 20+ years. It has been a mainstay for all glaucoma specialists in their treatment paradigm. The mechanism of action is decreased aqueous production with a possible multifactorial increase in outflow. Complications utilizing this procedure can be moderate to severe, and they can include inflammation, hypotony, hemorrhage, and in rare cases, ptysis. Continuous wave mode is typically reserved for extremely high pressures, emergency situations, painful eyes, and end-stage glaucoma. Recently, a modified form of continuous wave diode laser treatment has emerged using lower powers with longer durations to limit the amount of moderate to severe complications, but elicit the same type of efficacy. Micropulse mode takes the same continuous wave diode laser and chops it into gentle packets of thermal energy. By introducing a duty cycle that turns the laser on 0.5 seconds and then off 1.1 seconds, it allows for a much smaller insult to the ciliary body and much lower complication rates. The mechanism of action is decreased aqueous production with a possible multifactorial increase in outflow. The complications are considered low to moderate, and they can include inflammation and transient mydriasis. Micropulse is gentle enough to allow for enhancements and treatment titration. Histologically, when we look at the different treatments, you can see a vast difference in the amount of insult that has been introduced to the ciliary body. Top line is our control with basically no insult. The second slide set shows the low burn or lower power, higher duration continuous wave mode, which will introduce a larger insult, but far from the traditional transscleral cyclophotocoagulation, which has a fairly encompassing tissue denaturing and insult to the ciliary body. On the other hand, micropulse mode basically introduces a very small insult to that tissue. The treatment delivery devices for the Cyclo G6 are as follows. The G-Probe and the G-Probe Illuminate are for continuous wave treatments, and the MP3 or micropulse probe for micropulse mode. They utilize two different techniques, one doing discrete spot placements, the other doing a painting or moving of the probe along the limbus. When looking at an 810 nanometer diode laser, we must look at laser safety. Lasers generate a highly concentrated beam of light that may cause injury if improperly used. To protect the patient and the operating personnel, the entire laser and the appropriate delivery system operating manuals should be carefully read and comprehended before operation. Never look directly into the aiming or treatment beam apertures or the fiber optic cables that deliver the laser beams, with or without laser safety wear. Never look directly into the laser light source or at laser light scatter from bright reflective surfaces. Avoid directing the treatment beam at highly reflective surfaces such as metal instruments. Ensure that all personnel in the treatment room are wearing the appropriate laser safety eyewear, and never substitute prescription eyewear for laser safety eyewear. To avoid the risk of shock, this equipment must be connected to a supply mains with protective earth grounding. Let's take a look at the Cyclo G6 laser console. From right to left, first knob is for duty cycle. The second knob adjusts power. The third knob is for duration. There are two ports to the left. First port is for the laser aperture. The second port is for the illumination aperture. Once you turn the key for the Cyclo G6 console on, you will see an initializing screen in which the laser will go through its self-check. Once this is complete, you can now plug in the laser aperture for the delivery device. The knob screws in, and once you start to tighten it down, you will see an orange to yellow glow around the probe, initializing that it has been seated properly. Make sure it is tight, but not too tight. Here's a picture of both the micropulse mode and continuous wave mode. Micropulse mode on the left, continuous wave mode on the right. You can see that on the right, the UP or micropulse is off. There is a duration of 4,000 milliseconds. You'll adjust the power to the desired power and then push OK. On the left side, you have micropulse mode, which tells you the duty cycle, 31.3% or 0.5 milliseconds on, 1.1 milliseconds off. And then you have a duration of 50 seconds, and you can set the power with the middle knob there and push OK. Once you push OK in either mode, you will get this warning, which verifies that you have your 810 nanometer safety filter eyewear on. Once this is present, push OK. The micropulse mode then shows here a duration of 90 seconds, and you will see a stopwatch right here, which will count down automatically when you begin the procedure. You'll set the power rating at 2,000 milliwatts to begin with. As you can see, there is an orange glow to the initiation button here, and the unit is still in standby. Here you can see the continuous wave mode screen. 2,000 milliseconds for duration. You'll input 2,000 milliwatts on the power. And once you are ready to treat, you will push the initiation button, which will then blink green and turn solid, which tells you you are ready to treat. In continuous wave mode, this is what you will need for the procedure. Acceptable anesthesia is retrobulbar, peribulbar, or mild sedation. Intraoptic supplies will be needed, your laser safety glasses, a speculum, which is optional, a coupling agent, either BSS or a gonioscopy type gel. Q-tips and or a scleral depressor or muscle hook may be required. Postoperative supplies and meds. If you utilize retrobulbar or peribulbar anesthesia and eye patch, topical steroid drops, and or possible subconjunctival steroid injection. Here are the settings for continuous wave mode in the classical sense. 2000 milliwatts power setting, a duration for 2000 milliseconds. Typically do 18 to 21 spots for 270 degrees, sparing the temporal aspects, 6 to 7 spots per quadrant. The technique is to align the probe with the limbus, make sure the probe has and is in a liquid interface, apply adequate pressure when delivering the treatment, step on the foot pedal and wait for the treatment duration. Then you move the probe to the next desired spot location. Remember that if you do hear a pop, that is what we are tuning to on the power. Once you hear a pop, you should lower the power setting by 100 milliwatts, apply another application until you do not hear a pop, and then continue with the rest of the treatment. For continuous wave mode slow burn, the power settings are a little bit lower. For dark eyes, 1250 milliwatts for a duration of 4000 milliseconds. For light eyes, 1500 milliwatts for a duration of 3500 milliseconds. Again, 18 to 21 spots, 270 degrees, sparing the temporal aspect. 6 to 7 spots per quadrant, and the technique is identical, tuning towards the pop and then backing off until you do not hear one. For micropulse mode, the requirements are similar in terms of anesthesia, intraoperative supplies, and postoperative supplies and medications. The micropulse mode operates with a power setting of 2000 milliwatts. The treatment duration, if you're doing hemisphere treatments, is 80 seconds per hemisphere. If you're doing quadrants, it would be 40 seconds per quadrant. The dwell time, which is the number of passes per treatment duration, is 4 to 5 passes. So if you're doing 6 clock hours or a hemisphere, it would be 4 to 5 passes for 80 seconds. If you're doing 3 clock hours or a quadrant, it would be 4 to 5 passes per 40 seconds. The duty cycle remains the same throughout. The surgical technique for micropulse is a little bit different than continuous wave. The probe has an orientation with the flat side of the probe towards the limbus. We want to leave about 1 to 2 millimeters of white between the probe and the limbus. We want to make sure that the probe is in a liquid interface of at least BSS or gonioscopy gel. We want to be aiming the probe towards the center of the globe. We want to apply adequate pressure when delivering the treatment, much like you would with a writing utensil. And the dwell time is, again, 4 to 5 passes per treatment duration. Very important to ensure that you have adequate exposure to deliver the treatment. Typically, this is harder in the superior aspect than in the inferior aspect. And some surgeons choose to not use a speculum as it may get into the way. Being comfortable while you're delivering the treatment is highly important to ensure proper technique and desired efficacy while limiting complications. If you are comfortable, you can spend more time concentrating on good technique. Let's take a look at the micropulse surgical technique and variables. Utilization of a liquid interface is imperative. If you do not use a liquid interface, this could result in a loss of up to 50% of delivered desired energy and a significant decrease in efficacy. Probe orientation. If the probe is oriented incorrectly, this will move the fiber closer to the limbus and increase possible complications. Position from the limbus. If an adequate amount of sclera is not positioned between the limbus and the probe, this also can lead to increased complications. Angle of the probe. By angling the probe towards the center of the globe, we keep the energy focused on the ciliary body and away from tissues that we do not want to treat. Pressure. By applying adequate pressure, much like a writing instrument, we are making sure that the energy is delivered where it belongs without loss. Technique. Looking at hemispheres versus quadrant, both work, but the more comfortable you are in its utilization, the better your treatment will be. So if you're more comfortable doing 3 clock hours because exposure is better, that is fine. If you're more comfortable doing 6 clock hours and a hemispheric approach, that is fine as well. They both lead to good efficacy. Dwell time. Dwell time seems to correlate directly to efficacy. Slower is better, but only to a point. The dwell time of 4 to 5 passes for 80 seconds for hemisphere or 40 seconds for quadrant seems to deliver the best amount of efficacy with the least amount of complications. Power. Good technique leads to lower powers to deliver the same amount of efficacy, as well as duration. So once your technique is perfected, you may find that lower powers will deliver the same amount of efficacy and a lower rate of complications. Understanding the probe design of the MicroPulse MP3 probe. The fiber optic, which you see, is offset 2/3 to one side of the probe and 1/3 to the other side of the probe. This is what makes it crucial that we have it oriented in the proper format. The fiber is also called a bubble fiber. To produce this, we must heat the fiber optic, which in turn will remove the insulation factor. If you look at the way light and its indices moves through the fiber, it doesn't move in a straight line. It basically bounces back and forth off of that insulation or cladding and then is delivered at the end of the probe. Because this fiber and insulation has been changed by producing this bubble probe, it is essential that it is in a liquid interface to deliver and couple all of that energy into the tissue that you desire to treat. If you are not in a liquid interface, this energy will disperse up to 50% sideways coming out of the probe as opposed to being delivered where it's desired. It's also imperative to know that this 2/3 offset helps to position the probe over the ciliary body for the treatment as opposed to moving it closer to the limbus. So if you orient it with the flat side toward the limbus, you are going to be treating in undesirable areas of the eye. The probe should be aimed towards the center of the globe. Misalignment of the probe could lead to less than desired efficacy and an increase in complications. Orientation or placement puts the flat side of the probe towards the eyelids and the round side of the probe and notch towards the limbus. We want to leave about 1 to 2 millimeters of scleral stripe between the probe and the limbus. And there again, this is imperative to make sure that the alignment of the fiber is over the ciliary body. So who can be treated with the Cyclo G6 laser system? In the MicroPulse mode, basically we can start in the low to moderate glaucoma therapies and work our ways up to the more severe and advanced glaucoma therapies. On the G-probe side of things, these are basically designed for more advanced and severe glaucoma treatments. MicroPulse can be used prior to, in conjunction with, and following any current glaucoma therapy or procedure present in the market today. A statement no other glaucoma company can make. Thank you for your time in exploring the IRIDEX Cyclo G6 glaucoma laser system.